we would like to have closure words by Elies van Belle. She's chair of Because Health. So Elies, the floor is yours.
Much, Annabelle. Wow, I actually don't know what to say. I am so impressed by the number, the variety, the quality of the presentations. Also, the first time I witnessed such an effective time management. It's too early to start thanking people, and even though I would like to, because everything that happened today was really the result of the collaboration between so many people. But we will keep that for tomorrow. I find it difficult to find words to close this day, and I still find it very difficult to talk to a screen. Also, it has many advantages, and we saw with participation of people who are now in the night and others who are in the early morning. So this result, this unwanted result of the COVID pandemic, I'm sure we will take along. Last year, we canceled the Because Health conference because we thought, no, we are not going to do an online conference. We need the networking, we need the people, we need to be able to exchange. And I still find it very difficult to say that this is the right way, but I now see many advantages as well. So I hope we find a blended way in the future and we move forward. Unfortunately, tomorrow will be completely online, as well, as Karel just mentioned. Unfortunately, but we will miss out on the networking side. I'm not going to try to summarize what I saw today. There was too much, but maybe just a word. I was challenged particularly by two statements, both mentioned by several speakers. The first, that medical doctors can do more, and the second, that alone we go fast, but together we go further, but that it doesn't come naturally to many people. And related to that, as Karel already mentioned, the ant heap story, where all the ants together managed to get things organized much better than humans, where human beings are much more intelligent, each one individually. So I said I recognize, or I was challenged particularly by those statements. I recognize both. I was trained as a general practitioner, and I completely agree with the fact that particularly a family doctor has not only the task to look at medical clinical problems, but has to look at the person in his whole environment, and that we can do so much more if we interlink the many dots that float around every individual. Maybe I want to then go to multidisciplinary approaches and intersectoral collaboration. I just like to illustrate with a recent experience. A couple of weeks ago, I was in the east of Congo. I was in Bunia. Now, Bunia is in the province of Ituri, and it's been challenged by aggressive attacks for many years now. It's sometimes in the news, but it's most of the time not at all in the news. And I was visiting the IDP camps of the internally displaced people. They're all in the province. They come from the same province, and they moved because it's so dangerous, because their villages are being burned. They're estimated to be over 3 million. They're in camps and they're in families in the cities. They're everywhere. The system is completely down. All these people, what we were looking at, because I work with a medical NGO, we're looking at, do they have access to health? Well, no, they don't have access to health. That's quite obvious. Many of them do not have access to health, but there's so much more to it. They fled the whole region, which is close to Uganda, close to Lake Albert, which is a fertile region. They produce the food that nourishes the province. So the whole food production is down. So not only are all these people facing malnutrition, housing problems, health problems, etc., they're also impacting the whole province because the production of food for all these people is down. So inflation is coming or is already there. Everything is getting more expensive. All these children don't have education. There are so many different aspects that are impacting this whole province, and only lack of access to health. But this was just challenging me because if we look at the whole system and everything that happens, this is not directly related to climate change, but then we see that if we try to collaborate, not only within our sector, but also with all the other sectors and with at different levels of society, that we see a whole different problem, and that we might need to tackle it otherwise. If I heard in the morning from Sabine Gabrisch that the 50 poorest emit less than 10%, then we're not very interested in these people if we're talking about climate change, because they are not the main cause of the problem. But when I was in those IDP camps, those people they couldn't care less, I would say, but they just are not aware at all about having to eat less beef to save the planet, for example, or wearing a mask for COVID. I mean, these things just do not exist there. And I'm saying this because I think there are so many people that are not aware of this whole discussion, and that also is an issue and a problem. A problem. It's so easy to say all this when you're sitting on a chair and you have access to all the information possible, and you're literate and you have enough food and you're in a warm room, etc. But so many people have no idea what we're talking about, and maybe they're not the cause of the problem today, but the fight against poverty stays one of our top priorities, and we can only hope that we will go forward, and that in the years to come there will be more equal societies, and there will be more equity in different aspects of life. And in everything that I hear now, I think many people touched upon it, that there is such a big population on this planet that is not aware of so many discussions that are today on the table. I'm not coming with answers, but it's something that I think is interesting to continue to reflect on if you want to take this whole discussion further. So these were just some elements that I picked up today. It's only the end of the first day, and tomorrow we have a very interesting second day, for which I will now, in the last 2 minutes, try to really stimulate you to participate, because tomorrow we will get much more into concrete actions, into what can be done, into opportunities for action. We will have 2 keynote speakers who will be setting the scene, and the first is Renée Lowenson. She will talk about engaging with how to achieve healthy societies. And after her, Virginia Talens will speak on climate justice and health equity. In the afternoon, we have again interesting thematic sessions with speakers from all over the world and from different backgrounds on transformative communities, transformative policies, and transformative health systems. And not to forget, we have climate poets tomorrow who will put everything on rhythm and rhyme, and during the lunch break give some another aspect on or use other methods, let's say it like that. We will finish the day tomorrow with an international panel that will engage in a debate around all the information we will have heard by then. And unfortunately, there will not be a reception afterwards, but I'm sure we will be able to make up for that some other time. So a warm welcome already to tomorrow, where I will briefly open the day again. And thank you very much for participating. It's been, for me at least, a very interesting experience. Thank you.
Thank you very much, Elies van Belle. See you tomorrow, Central European time, 10 o'clock, so the same time as today, and we'll look into the opportunities. And indeed, as you say, Elies van Belle, so little people know about the importance of this climate justice, especially the rich ones who have no clue of the impact that they have worldwide. So it's good to look into it. Also, thank you to all the collaborators for today, and they'll be there tomorrow again. I hope you'll be there too. See you.